Hey there, health and wellness fans. Welcome to episode 12 of the 𝗖𝗓cast, the podcast that's revolutionizing the way men think about their health and wellness and their life, one conversation at a time. I'm Tony LaRosa, and look who's here. We have him, our producer, the man behind the scenes, the guy that makes it all work, Keith.
What's up?
How you doing, man?
I am fabulous. Excited to be here.
Thanks for joining us. Rob had a last minute thing he had to attend to, so it's you and I.
All right, let's do it.
We're the handsome ones, so I think everyone's going to be fine with that. So, hey, we've got a really cool show for you tonight. Very important topic, sensitive to a lot of people, affects a lot of people in this country. Mental health in the military.
It's huge.
Yeah. And we were talking before we went live about, is this show for only a certain amount of people? Maybe if you're in the military, but this topic extends to family members. It extends to the community. You don't have to know someone in the military. You don't have to be in the military. You can give back to people in the military in your community. There are plenty of organizations and events and things we can do to, help our servicemen while they're serving and when they get back into the civilian life.
Yep.
And I know you have some family members who have served.
I do, and friends too. Friends who have dealt with certain issues as well. Yeah, absolutely.
And it's important, and we'll get into this too, but it's important to, recognize the sacrifices because it's a lot different in that part of the world.
Oh yeah.
We all know.
Yeah.
So an amazing guest tonight. And we were talking before the show. I mean, this woman is so decorated, and her credentials are incredible. So this is Dr. Monique Chouraeshkenazi. I think I pronounced that correctly this time. She's a combat vet, CEO, clinical neuropsychometrician. She's going to have to tell us what that is.
Yes.
Professor, forensic neuropsychopathology expert, international best-selling author, Dr. Monique Chouraeshkenazi. Hi, Monique. How are you?
Hello. I am well. How are you all?
Excellent.
Doing fantastic. We had a good conversation before we went live and kind of gave us a little bit about, what you do and the people you help, because it's such an important subject for all of us to understand the commitment, not only by our servicemen, but by you as well, because you're out there treating people when they're in the service, and then when they come out into the civilian world, which we're going to touch on too. So why don't you give us a little bit of background of yourself, if you can, and maybe just give just an idea of, what you see on a daily basis. And then we can dive a little deeper into, maybe some stories and some first takes by you over the years.
Well, I'll keep it short. I'm a 13-year Air Force vet. I started doing communications and information, and then I transferred over to national security towards the end. Once I got out, which I will talk about that later, one of the primary reasons why I got out, I started teaching full-time, doing research, and developed this interest in psychology. So that's why I'm where I'm at right now. And we'll further discuss about the forensic neuropsychopathology, because that all expounded from my experiences in the military. Some of the things that I do see on a daily basis, and it's not even just doing clinical evaluations, it's just really seeing how people really connect with mental health on a daily basis.
Right.
Something that we never talked about back in the day, but now because, COVID, political issues, religious issues, I think people are talking more about mental health, and it's a regular conversation. I just opened up my practice again doing clinical work actually yesterday. So I haven't actively been seeing patients, but just talking to people and consulting with others. We see a lot of anxiety, depression, trauma, and people are going to therapy now more than ever to really combat those issues. So that's what I'm literally seeing on a daily basis, is just talking to people, not just colleagues or, from the patients, just talking to neighbors and people you meet off the street. Mental health is always coming up in the conversation.
Yeah.
Yeah, you brought up something when you first started talking about some other these distractions like politics and other social environmental things that are happening in today's world. So they don't make things better, right? It's not only dealing with your trauma, but you're also dealing with social things that are constantly surrounding you, and the ups and downs of the political climate. So I don't think it is what it used to be, and we have to be able to, as a community, just be able to understand that, especially from our service people and people that we know who have been on tour or just gotten back and things like that. The commitment made by those who served in our armed forces extend way beyond the call of duty. They navigate unique and often extreme environments, facing challenges that can leave indelible marks, not just physically, but deeply within their mental and emotional landscape. So it's important that we provide a more comprehensive understanding of mental health experiences of our servicemen, from the pressures of active duty to the often turbulent journey of reintegrating into civilian life, which is important. So we'll dive into those specific stresses that impact various aspects of their lives, and we'll explore some new pathways toward healing and support. So I thought we would start with, some of these unseen battles that, mental health challenges during active duty, I think is, significantly important for people in the service. So beyond, I guess my first question is, beyond the obvious risks of combat, what are some of the chronic day-to-day stresses inherent to military life that contribute to mental health challenges?
I think we'd like to always think about, when we're talking about military, we're always talking about combat and deployments, and that's the reason for mental health challenges. That's a large part of it, but also, as you mentioned, the daily stressors, it depends on the job that they're doing in the military. There's so many different jobs, from banking, finance, personnel readiness, and then you have your infantry, aviation. There's so many different jobs. So working with the military and being what we call in garrison, which is in the United States, they deal with stressors just based on authority and discipline within their workplaces, and the training and the constant education that they have to be abreast of to do their job on a daily basis. Those also are factors that cause mental health challenges. It's not really always based on deployment. It's just being that good seaman, airman, soldier, Marine to do your job on a daily basis. And with that becomes challenges because there are high stakes jobs, and it's not really based on, oh yeah, we're sitting here in a combat zone every day. They're constantly in that cycle of preparing to go to combat.
Right.
So that's another factor too. They might be in the United States, but they're constantly training. So war is always in the back of their heads. That becomes a stressor, which can really bleed into their personal lives, because if they're working constantly and that's their focus, then they're coming home and they can't really shut that off. Right. They're really thinking about, when am I leaving? Am I doing the best job? Then there's promotion and education. Everybody wants to move up in that rank because everybody wants to do their best. Everybody wants to be seen to be the best of the best in the military. So you have to think about those stressors too. Not only some, military personnel are working long hours, then you have to do temporary duty training. You have to do education. Everything comes first with the mission. Sometimes the family matters are put to the side, which can really increase mental health challenges if that causes tension within the home.
Right. And then you said something earlier, like you're not sure when you're going to leave. So these unpredictable deployments, I'm sure they disrupt family, especially if you have like kids, right? And the kids are just getting used to dad or mom being home, and then all of a sudden, poof, they're gone. And so that military life doesn't just extend to, well, it doesn't just mean the service person, but it also can extend to the family, the spouse, the children, and other family members. Constant relocation, I'm sure is hard, because I know, like, when I was young, I think I moved like 2 or 3 times. I was like, man, this is a pain in the ass.
Yeah.
But people are, move 10, 12, 15 times within a year, if you have to. And then I think some of the other things that we've talked about on some of the other shows, like when we're talking about supplements and just health and wellness in general, is sleep is such an important factor for your health and wellness. And I think I have a couple friends who have served, and that's one of the biggest things they always tell me. And I'm always getting them some sleep supplements and melatonin and anything that helps. And they say sleep deprivation is like one of the worst things that they're dealing with. It just adds to their trauma because they can't heal. And we all know sleep has such an important role in healing.
It regenerates the body for sure.
Yeah. And you're also very equipped knowledge-wise in health and wellness. So I think this is all part of, some of the work that you do is, integrating health and wellness into how you treat your clients, and the whole philosophy, I think, starts from that, I would think.
Mm-hmm.
So my second question, the pressure to maintain a stoic demeanor. Can you elaborate on how this cultural norm within the military can act as a barrier to seeking help? Because I think one of the things of Project Y, the mission is to, get men to be able to take care of themselves and take control of their health and wellness. But the biggest barrier that we've seen, and we've talked to a lot of men about this, is the stigma. Is how do we overcome, I don't want to get hair replacement therapy because that's not manly, or, all these things, testosterone, everyone's afraid of it. People are coming along now, but what do you see is the barrier to seek help?
So I joined the military right at the beginning of the 21st century. And I can honestly say between then and now, there's a significant difference, even a significant difference between the 21st and the 20th century. There's always been this mantra of anybody serving in the military, men and women, you have to present a certain way in terms of persona, demeanor, attitude, behavior. And so it's always been, I would go as far to say for every branch of service, to have not only just, I would say, strict discipline, the way you look, but it's also internalizing and having emotional intelligence.
Right.
I know when I went through basic training, we were told to toughen it up and don't show your emotion. So in basic training, you're already trained to do that. And you're very much influenced, especially if you're coming in very young. I came in, I signed up at 17. I went to basic training at 18. What a lot of people don't know is your brain is still developing. Even though you're a late adolescent, your brain is still developing until your mid-20s.
Right.
So when you're at 18, 19, and you're in military basic training, and you have people telling you exactly how to, talk, walk, what to say, what time to get up, when to eat, what to wear, you develop this demeanor of, I got to toughen up, because if I show weakness, I'm going to be ousted. If I show weakness, I'm going to be, isolated and picked out of the bunch. So from a young age in the military, you're told to be strong, don't show emotion. So by the time you get to your first duty station, and you're doing your job, it's something that's almost like an instinctive trait that you walk around being strong, knowing that you're doing your job and doing your mission and not really caring what anybody thinks, because you're a military seaman, soldier, Marine, airman, and you were trained and taught you can't show emotion. So the stigma behind that is now that people are silently suffering from mental health conditions. They don't want to report it because, one, fear of losing their jobs. A lot of them have military clearances, and they need those clearances to do their job. So they don't want to disclose that they need help because they fear that their job might be in jeopardy, or even based on the severity of the condition, they can be med boarded and be separated from the military. So even though I think overall the Department of Defense is doing a great job of improving programs, I think there's people still in the military who are still afraid because of that stigma of being judged, being isolated, their fear of job security, and then that overall foundation of growing up from day one in the military and training, knowing I have to be strong and I can't show emotion because if I do, I am weak.
Right.
Yeah.
Mission first, I think.
Mission first, everything else.
Well, the flip side of that, and I'm curious about, is so when you're in basic training, you're in the military, you're used to structure, right? You're used to people telling you when to eat, how to eat, sleep. When you get out and you're back in civilian life, you suddenly don't have that anymore, right?
Exactly.
That plays a big effect, I would imagine, emotionally.
It does.
Yeah.
For sure. Like I said, I joined at 17. I had to talk my grandmother into signing. I'm like, in 2 more months, I'm going to be 18. I'm going to sign up on my own. So imagine signing up for the military at 17, getting out at 31. Yeah. That's when I got out, 31.
Wow.
And now you're trying to navigate. You're no longer active duty, but you're not really a civilian. You're a veteran.
Yeah.
You're always going to be a veteran. I don't consider myself a civilian. I consider myself a veteran. And it's very hard to transition if you don't have the proper resources. Yeah. And I see a lot of military service members struggle with that because of the sense of their identity. They feel like their identity is lost. They feel like they don't know anywhere, have anywhere to go, or just that pride of being in the military. You no longer have that. Now you're just a number. You're just the person on the street. Yeah. And I see that with even high level enlisted members, because you can be the highest of the high and be highly decorated, but then you get out and you apply for a job. They don't care that you were a chief master sergeant. They're like,
right.
What are your skills?
Yeah, exactly.
What can you do? We don't care what, And then there's a focus on that too, because it's enlisted versus officers. Now we know high rated and high level officers go on to get good jobs. They basically have a job for them once they get out. They go to be like political commentators or on the news or be CEOs of companies and, contracting. And it's easier for them, in my opinion. But the ones I feel struggle the most are the enlisted, transitioning out and trying to find, who am I in the second chapter of my life?
Yeah. You're saying so many awesome things. I've got all these questions. Every time you say something, I'm like, oh my God, I gotta ask that. I don't want to divert too much from our topic, but you said you joined at 17. So if you can share, like, what's that mentality like? I've never been in the military. I don't have a ton of people like growing up at that age, knowing anyone, maybe one or two people. I know I had one guy I graduated with who was in Desert Storm. But what is that? Like, what's the attraction? What was it for you going in? Was it just that need to serve or challenge yourself, or what can you share with us?
I'll be honest, it was very random. I had a full academic scholarship to go to Marshall University in West Virginia. So I had actually went to the campus, went to the banquet, and about 3 weeks before I started high school, my senior year in high school, I saw an Air Force commercial. And I was like, oh, this is pretty cool. It was a commercial, them going through basic training. And I'm like, oh, this is cool. And it piqued my interest. So I just, I got online and I seen the nearest recruiter, and I remember it being like a Friday. And I emailed him, not expecting to get a quick response. He calls my house the next day in the morning on Saturday. I was like, hey, can you come down to the office? I can tell you more about the Air Force. I'm like, okay, cool. And so my grandmother took me down there, not thinking. She's like, oh, she's going to college, so I'll entertain her with this. But after 4 hours, I'm like, I'm joining the Air Force. And
wow.
Pretty much it was a done deal. And my grandmother was upset, but I promised her. She was like, you better get your education. If you're going to lose this scholarship to join the Air Force, get your education, get your degree. And I promised her that I would do it, and I did it.
Yeah. Well, you did it several times over. So you said 17. So I think you said 30 or 31. So it was like 14 years.
31. Mm-hmm.
Wow.
This year makes 10 years that I've separated.
Wow. Congratulations. Thank you for your service.
Yeah, thank you for your service.
Pleasure to serve. Thank you.
Yes. So are there specific types of, back to the mental health thing, and it's a little off track, but it's such good information. Are there specific types of mental health conditions that are more prevalent among active duty personnel that you see?
I would say the top conditions would be definitely anxiety, depression, TBIs, traumatic brain injuries, and PTSD. Those were the ones I saw the most. Those are the ones that I treated. When I used to do therapy back in the day, most of them had either TBI, depression, PTSD, and then I evaluated for those same things. And even my research is based on that. That's how forensic neuropsychopathology came to fruition, because of the prevalent amount of military service members that were diagnosed with depression, PTSD, and TBI.
Yeah. We see enough shows or programs on TV that, focus on military type topics. And, the one thing you see a lot of is substance abuse. Have you seen
That
or,
too, yeah.
yeah. What's that like, trying to work with someone? If you have, if not, I'm not sure. But what is it like working with someone in that situation who has maybe substance abuse and back into the civilian life? How does one deal with that? Because it's not just a normal thing where maybe you're hooked on a drug here, but you have all this other trauma. Do you feel it's different?
I do feel like it's different. When I was a research fellow at George Mason University, my entire population was veterans. And those veterans had issues with their service-connected benefits due to being either separated due to dishonorable discharge or medical discharge. And I would say about 90% of them had suffered from substance abuse. And I didn't provide therapy for them, but I evaluated them. And listening to their stories, it was very, disheartening to know that they didn't receive the proper resources and help. And so they didn't feel like they had anywhere to go or anyone to turn to. So they turned to, alcohol and drugs.
Yeah.
And some of them did so much drugs and alcohol that they end up developing like memory and attention issues. It affected their sleep. Some of them had to get on disability because they couldn't work because of it. And that's what angered me, because when they came to me, I was evaluating to help them go back and see if they can get their benefits so they can get the resources that they need, such as treatment. Some of them needed the medication. There's certain medications, and I'm sure you all know, being in the pharmaceutical industry, there's certain medications for alcohol abuse or, preventing them from having cravings for alcohol.
Right.
The medications would be expensive. They didn't have insurance. So they would come to me to get evaluated to determine at the time that they were separated from the military, did they suffer or meet the criteria for a mental health condition, so they can get those benefits to be able to get the medication that they need and get the therapy. Some of them needed surgeries. But I find that being in the military environment, being so structured, there's a thin line between them losing their cool. It's that thin line between what we call being normal and losing it just due to all the stressors of being in the military, and it being so easy for them to use alcohol and drugs to cope. So that's why I find that when military service members are separating, that they have like a really good transitioning program. And I feel like mental health should be highly prevalent in that process so they can determine what type of resources that they need. And if there is a chance that they might be separated due to dishonorable discharge or misconduct, that they really focus on mental health and determine if that was a factor in them, needing to, what we say, needing to like transition out, not on their own recognizance, but based on military standards.
Right. That structure we're talking about, of that high stakes environment, military service, to the norms of civilian life can be, I would think, a huge shock to the system. So what are some key specific mental health hurdles that veterans commonly face during the transition period?
Again, I would say like not having the proper resources or education. I can say when I was transitioning out 10 years ago, I can't even remember if there was somebody that came and talked to us about mental health. I
Right.
know that in order for me to put in a claim, I had to go see a psychologist to get screened. That's
Right.
all I remember. I don't know how it is now, but I know it's a program called TAPS, and it's for every branch of service. So it's called the Transition Assistance Program.
Mhm.
And that's where they that's where they start talking to military service members about finances, being able to have emergency funds, even learning about taxes, because those
Right.
things we don't have to worry about when we're on active duty. We're not
Exactly.
really like paying tax. We were paying taxes, but it's not like paying taxes as a civilian. So they bring people in to, you know, educate them on this is how life is going to be when you separate. And so it's business, finance, transitioning, being able to, you know, move, find a home, but they didn't really talk about mental health. So that's
Mhm.
where I find to be a challenge. Like if they don't have mental health services in that program, there's nobody to get screened to be like, hey, this person was on active duty for 20 plus years. And based on the criteria, they may meet the criteria for PTSD. This
Mhm.
was not highlighted on active duty service. This could be a problem. Let's have them evaluated because, you know, being able to have preventative measures, like being able to catch something and diagnose a person and say, oh, this member has PTSD, they can actively put them in the VA system and automatically bump them up so they can get the services that they need to treat it before it becomes worsened. Because what a lot of people don't realize, there can be people who are in the war, exposed to combat, come back home, be able to function, but they can separate, and it takes one situation for them to be provoked and not realize that they had an undisclosed mental disorder because they were never assessed for it. And it could be that one thing that sends them over the edge because they were never diagnosed or treated for it.
Yeah. That's
And I see that a lot.
yeah, that's sad. Well, don't feel. I mean, I'm running 2 businesses, and I still don't know what the hell I'm doing with my taxes. So if you're
Let me tell you the eye opener. When I found out how much taxes I had to pay, it's like, why did we not know about this sooner? Why are we
Yeah.
waiting until, you know, people separate to blow up their lives and stress them out? That's another thing too. You're
Yeah.
going through this program. It's about 2 weeks long. That's it. And they're
Mhm.
basically telling you how your world is going to be turned upside down in 2 weeks.
Right.
And then you're like, okay, try to fend for yourself now that you know all these things about being a veteran in the civilian world.
Yeah. Well, I think we all go through that in school. You know, as we're younger, we're learning, you know, trigonometry and all these things. Like I've never used it. I know there are people out there that may have, but we should be learning. I know there's schools, I think in Europe, they teach, you know, kids how to do their taxes. Those are the things we need to know.
Yeah.
Well, anyway, you mentioned PTSD a couple times, and I know we're going to rehash a lot of these things we're saying, but I think they're specific to some of these questions, so we may repeat some stuff. But how can the symptoms of PTSD manifest differently from what you've seen, or become more prominent during the transition to civilian life?
Well, there's different types of trauma and stress related disorders. You have PTSD, adjustment disorder, acute stress, and it's about knowing the difference between the three.
Mhm.
So PTSD usually happens about 30 days after they've been exposed to trauma. And it doesn't have to be exposed to combat like what we would actually think when we're thinking about military service members. It could be like you, for example, you just witnessed a car accident and somebody died. It didn't happen to you directly, but you saw it.
Right.
So now you're traumatized by it and you feel like, okay, the first few days you're okay. And then you start going about business as usual. But then you notice that you're having flashbacks, mood swings, you're sweating, you're irritated, you know, anxious, you're hyper vigilant, but you don't know what's going on. And you don't know it's necessarily related to that car accident that you saw, but you notice that you're feeling different, but you don't know why.
Right.
And that's usually how it starts. really don't know why these things are happening, but they're happening. And within the first few days, if you experience all these things and you know something's wrong, it's usually acute stress disorder. It's no more than 30 days. If all the symptoms pass, you're good. But the moment that those symptoms continue on and on past 30 days, more than likely it's PTSD. Adjustment disorder is basically like having issues adjusting to a certain environment or situation. And full disclosure, I was diagnosed with adjustment disorder back in 2017. I had a friend in the Air Force. She was a veteran and she committed suicide. So I went to therapy to try to deal with it. And my therapist was like, not only are you dealing with your friend's death, but you have adjustment disorder because you're having a hard time adjusting from military life to civilian life. She noticed it, and I didn't even know at the time. I didn't even know what adjustment disorder was, but she's like, you're highly stressed. You don't like the civilian world, which, to be honest, I didn't. I didn't understand how people can call older people by their first names. I was always like Mr., Mrs.
Right.
You know, I'm not going to call an 80-year-old man Jerry. You know, it was things in therapy that she was noticing and I didn't know. And she's like, you're having a rough time adjusting. And I'm like, well, when you're a teenager and then you get out at 31 and you think the life is supposed to be like military, like I got out thinking everybody's going to be like how it was when I was in the military. Everybody's going to be respectful. Everybody's going to have rules and policies and discipline. And then you get into the world and it's kind of like everybody's lackadaisy, you know, and the work environment's kind of like chill. And I'm like, I'm not used to that.
Right.
So it's like those things with the trauma and stress, you don't really know it's happening until it becomes a problem. Right. And when it becomes a problem, it's usually when other people notice around you, especially PTSD, like the flashbacks, even psychosis. There's some psychosis in PTSD when people feel like they're reliving, you know, the incident, and it becomes far more than you're like imagining things that were not there. So there's different symptoms. And the thing about PTSD is not a certain amount of symptoms, is a certain amount of symptoms that you have to meet to be diagnosed with it. But it's like 9 different ones, the main ones, but they don't have to be the same for everybody.
Right.
So
right.
one person gonna have this, one person gonna have that, and it's still PTSD.
It's I would think it's sort of like when they say spectrum.
It's something like a spectrum because there's so many different facets to it, and it's so complicated too because you have to be very specific. That's why I do an interview when people feel like they might have PTSD. I have to do like an 1.5 hour, 2-hour interview and go over each symptom. And if they say, yeah, I experienced this in the last 30 days, then they have to give me an example. You have to tell me how long, you know, what happened, how they reacted. It's very time consuming, but you want to ensure that you have the right diagnosis and ensure that it is PTSD.
Yeah. Keith, we had a question. I think your dad, can you read it? Because I can't read it.
So the question was, why had they shortened PTSD to PTS? Is it because they want to avoid the word disorder?
Well, to my knowledge, I go by the Bible, which is the American Psychiatric Association DSM-5 book, and the last edition is 2013. And in that edition, the D is not taken off. So PTS is something that I have not heard of.
Well, a lot has happened since 2013.
It has, but that's the book that we use to diagnose, and there hasn't been an updated version. There is one, it's called the TR, but even in there, I don't think that it's PTS.
Yeah.
But don't quote me on that because I use the other edition.
Well, it makes sense. I mean, you know, because we are constantly changing, you know, these, what do they call acronyms? Every other day there's something.
Let's put it this way. If they took the D off of PTS, they would have to take it off of every disorder in the book.
Correct.
Anxiety disorder, major depression disorder, personality disorder. They would have to do it for all of them.
Yeah. And I guess that also plays into the whole stigma part of it too. You know, maybe some people out there are like, well, I don't have a disorder, you know?
Oh, right. Yeah. It's definitely a controversial topic because even though people want to be evaluated or receive treatment to get help, they also don't want to be labeled. So to say I have a disorder sounds like something's wrong with you.
Right. Right. And thanks for the question. Whoever else has any more questions, please ask. And you get free product. That's right. If you ask a question tonight, you get some free moisturizing cream, which is great for your face. Yeah. And I'm going to send you some too, Monique, so don't worry. And we have this eye serum, and the women love our product too. We can't keep it on the shelf because all the women are taking it from their husbands.
Oh, so you have products for women too?
Well, these are for men. You know the old commercial, strong enough for a man, but made for a woman? So this is strong enough for a man, but made for a woman.
Got it.
No, I'm sorry, strong enough for a woman, made for a man, right?
There you go.
So we that's a good thing. So yeah, if you have a question, ask away. We're sending away some cool new products that we've just developed here in-house that we're promoting. And back to the topic. So we talked about that, the transition several times, but what do you feel, how do you feel the veterans cope with that disconnect the first time they come back? I mean, I'm sure struggling to find some meaning and purpose is huge. And we talked about, people not understanding, getting the recognition. What are some of those things, specific things that you can share with us?
In terms of transitioning from like deployment back home, or transitioning into civilianhood? It's
transitioning into civilianhood, like some of those, it's that disconnect we were talking about earlier, like, not saying Mr. to Jerry.
I would say the top thing would be the loss of identity, because a lot of us who are in the military is our identity. And when you leave, what are you without the military? You know, I always walk around saying you can take the girl out the military, but not the military out the girl. So I think that's the first struggle, trying to figure out who you are without having that part in your life anymore. And that causes a struggle with, friends, family, relationships, because if you're struggling with trying to figure out who you are after so many years in the military, it definitely bleeds into those relationships. And I would say there's difficulty in communicating that. Some people who have a loss of identity don't want to share with others or don't want to communicate. So when you really cause contention in those relationships, people don't want to be bothered, especially if you're not going to express how you feel and nobody knows what's going on, what's wrong with you. It makes it an even challenging situation, because now you're isolating people, but then you want people in to support you, and you can't have it both ways. You're going to have to be vulnerable, transparent, and express yourself in order to get the support that you need. And I see that as being a major challenge, especially for men coming out the military, because the ones that I've worked with, they said that they feel like they're less of a man because now they get out the military and they can't find a job.
Yeah.
Right.
They get out the military and maybe they had a great job doing what they did in the military, but it doesn't translate to the civilian sector.
Right.
For example, my ex-husband was an aircraft maintenance sergeant. So he loaded missiles onto jets. How does that translate into, the civilian sector? But
they don't do that. They don't do that at Walmart anymore.
Something else, but a lot of people are not in that position. And some military members go their whole career without getting an education. So now they only have a trade and skills, but they don't have the education that's highly required in the civilian life once they separate. Yeah,
this career thing, you got me thinking early on in the conversation, because you mentioned jobs, and it's one of the biggest frustrations I have, like when I think about veterans and their transition is, we got a lot of smart people in the, I want to say we have a lot of smart people in the government, but I don't know. This is another subject and maybe another show, but it is incredible to me how, someone can come back that highly skilled, handling missiles and can't get a job. Yeah. But there's got to be something we can do. But I'd like to maybe dive into that potentially on another show, because it seems like you have a lot of knowledge on that, and we can definitely I think there's a lot of people out there that want to hear that. I certainly want to hear it.
Sure.
I do want to say something about that though, quick. So I'm in the electronic security industry. I've been for 18 years, and one thing that most of the companies I work for in the past, they have a military program to where when they hire a position, they'll go out to military first, before going to civilians. And that's one thing I've noticed. It was a big success with a couple of the companies that I work for, and it put a lot of people, in employment. So companies can do stuff like that.
And now I know they have like skill bridge programs that transition like military to civilian jobs. But like I said, back in the day, it was tough. Like I had a lot of friends that got out before me and struggled to find a job. And I'm like, we have so much training. And I made a point throughout my career. I made a point that wherever I went, wherever I was stationed, I was going to get the education and training, no matter what it was, because I'll always want to be, valuable on the other side.
Right.
So like when I worked in Intel, I worked in electronic security too, in physical security.
Okay.
Even though that wasn't my job, I went with all of my colleagues. I went to all their trainings, got certified. And that led me to other different jobs that I didn't think I would have because of that.
Yeah.
Right.
That's awesome.
Well, I've noticed too, it really, we're focused on the military and people coming back with skills, but there are people that go to college today who aren't in the military or service people and can't find a job. So it's really rough out there as far as education goes. I think it's ingrained in most people, maybe not so much today, but when I grew up, it's like go to college, and you come out with a degree and you don't know where to place it. But that's another show. So I know we're talking a lot about the transition into civilian lives. So I want to parse this because I think it's important to also, talk about the family. So how does the transition back into civilian life affect family dynamics and intimate relationships? Specifically, have you seen, like, what have you dealt with in the past with some of your clients and some of their stories?
I would say that the military has like the highest divorce rate I've ever seen. By the time I separated, I know it was at 80%.
Wow.
So we're talking about a decade later. When we're talking about so many things have happened since I transitioned. We've been through 2 different presidential administrations, so many different changes in the military. Can you imagine like even the things that affect, such as presidential elections affecting the military, how that bleeds into personal life? So when you see a high rate of military divorces, and I'm a product of one, it just shows the stressors, the high stressors that we have as military service members. Not only do we have to work long hours, constantly train, and like I mentioned, I'm like, everything is not about deployment, but then everything is about deployment because the whole point of being in the military is to be prepared to deploy. It's called being mission ready, personnel ready. So when you're constantly focused on the mission, not only that brings stress to your home, but when you think about on a daily basis, there's some issues that I've seen with military service members that they have contention with their kids and their spouses because they cannot relate to what they're going through on a daily basis. Like if you have that strong camaraderie with your leadership, with your coworkers, because we're all in the trenches together. Even when we deploy together. So your spouse and your kids at home, they don't understand that. So when you come back different, or even if you don't deploy, you're just working every day and you come home and you just want to talk and shoot the shit, and your spouse is just looking at you like, whatever, I don't care. Leave that, at work because everything's military. Just be home and be my wife or be my husband, be the father, be the mother. You can't really turn that off because the military is your life. And I find that a lot of the ones that I work with, it's like, my spouse doesn't get it. They don't understand. That's why I like working long hours sometimes, or I just like hanging out with my friends because coming home, I'm being nagged. I didn't do my chores. I didn't do what I was supposed to do, or I worked 12 hours and now I have to go and cut the grass or run errands. And they just find that it's hard to be able to sit there with their family members and be able to discuss things. And then there's other service members that have jobs that they can't talk about. So that causes stress because if it's a stressful job and then you can't really release and share it, that causes some tension too. So I saw a lot of that with working with members about being able to, relate to them.
What What about military to military relationships? Like if you meet in the military, you get married and you have that relationship, you both serve. Does that have a lower instance of divorce rate, or is it about the same?
Not to be negative, but it's actually worse.
Is it really?
It's because like you got to think if your spouse is also military, which my spouse was also military when we were married, you're constantly on the go. Like I was like, when I told you when I was married, I was electronic security, physical security information. So I worked really long hours doing that. And then my ex was like the aircraft maintenance. We both worked 12-hour shifts, but his was swings, nights, mids.
Oh,
We
okay.
never saw each other sometimes. You know, sometimes he didn't even see our kid because he would come home and go straight to sleep and never see our daughter. So that's stressful when you're never seeing your spouse. And then you feel like you're living two different lives and you just happen to live in the same space. And that goes for a lot of military spouses. Like they're constantly deploying, going TDY, then stress, who's watching our kids,
Right.
then money issues too. That causes a lot of strife in the military because, you know, we don't necessarily get paid the best.
Mhm.
So you find the military is tougher because everybody has their responsibilities and their jobs, and that comes first and everything else kind of comes second.
You know, you see these movies, we've all seen it where, you know, like the guy is going into the military and the woman is like all intrigued by this. And it's like kind of like a little fairy tale thing. And if people knew how difficult it is, you know, 3 or 4 years into the future of maintaining a relationship, an intimate relationship, then I think a lot of people would, you know, change their mind. But it's something I guess we all have to go through and,
True.
you know, at some point figure out. Back
And I
to
don't want to be a negative Nancy. There are successful marriages. There are a lot. You know, I've seen some married 30, 40 years, you know, but it takes a special person, especially a person who's not in the military. It takes a special person to be able to stay and to help sustain that marriage throughout that time. So,
yeah, I think a lot of people can read through the lines. It's educating. It's, you know, this is what is going to happen, prepare it, but you could still navigate a relationship and be successful as long as you're aware. Because I think I'm sure there are plenty of people that go into a relationship at that level with blinders on and thinking everything is going to be perfect, you know. And, do we have another question, Keith?
We do. The question is, how does the change from military life to civilian life affect the children of military men and women?
Oh, that's a great question. I would say it definitely differs. The children do have, you know, they're highly influenced too, and it affects them, especially if they have to move every time their parents have to move. Just think about children who are moving from state to state, country to country, and they always have to adapt. They always have to make new friends. That becomes an issue for some kids that can't handle that. And I've known some military service members that I worked with, their kids were highly affected because they become isolated, because it's that fear of, I don't want to move here, get to know somebody, get attached to them, and then we're moving again or they're moving again.
Yeah.
And you see a lot of that. And it's a lot of, I would say, social and emotional development with children, having to always leave all the time and, you know, have to experience that more often than not. I would tell you that my daughter at one period went to 7 different schools in 1 year. Thank God she was like, you know, adjusted kid, so she was able to adapt. But even me and my ex were like, this is too much. We were both overlapped at one period in Afghanistan. What would have happened to her if one of us were killed, you know, in combat while we have a kid because we're overlapping deployments?
Right.
So I would say children, it's difficult for them to transition as much as it is for the military member to transition, because now they have this sense, even though they're moving constantly and they may not like it, once they're stabilized, they might not be used to it because they're so used to being on the go. And now that they know that they have a more stable home, there might be a fear that, okay, there might be a point that we might leave again. Or if they don't leave again, it's the fear of, why are we not leaving?
Yeah, true.
Yeah, very interesting. Now, reversing that, I guess, what can you elaborate on, like, specific ways that family, you know, spouse, children, the community, and peer support networks can act as a lifeline for veterans navigating some of these difficulties. And if there are any that you know of, standard organizations within communities that people may be unaware of, if you can share any of that to help, that would be great.
I would say that, and I can speak for those who I've worked with, and I think I can speak for the majority, that even though service members might have a difficult time expressing their emotions and communicating, it helps if their support systems, like their friends, family members, spouses, become those communicators for them.
Right.
It's touchy because based on what's going on with each person is unique. You don't want to push because some members do suffer from mental health conditions, and if you push, it might work against their favor.
Right.
I would say just be a strong support system. Be the one that's willing to look and find those resources if the person's not willing to do it.
Mm-hmm.
Because once they know they have somebody, who's really in their corner and is really there to, support them, I think that's the first step in them being willing to do the work. For example, I've worked with many of them who never wanted anybody's help and wanted to be alone, but they had that strong support system that didn't give up on them.
Right.
And that's what they needed at the end of the day, for people to show that I'm not going to just leave when things get hard. You keep pushing me. You don't want my help, but you still stay there. Even when I tell you to leave me alone, you still stay there. You're my support, and they'll finally open up. So having that strong support system and the person that's willing to find those resources to get them help, I think is paramount. There's so many organizations, I can't even think of all of them, but the first ones that come to mind is like the Disabled Veterans Association, Wounded Warrior Project. I know my friend has a nonprofit. It's called When Life Sucks.
Mm-hmm.
That's directly to veterans and their families. Those are the three that I can think of on the top of my head. But you also have mental health services like NAMI. Even in your areas, there should be like a county mental health program. I know like in the Virginia area and Maryland area, they call it like community service boards, where veterans can go and get county treatment. There's state programs too, based on what state that you live in. A lot of these resources can be found on the Department of Veterans Affairs website. And there's like a directory where you can go through based on your state and find additional resources.
And I was just told we have in the video after the show, if you click in the subject area of the video, you'll see some links to a lot of these organizations that Monique just mentioned, and some other ones there too. So we have some lined up, and that's the first step is making that call. And I would think too, I wanted to add education, because if you have a family member that's come back, that's a veteran, and like you said, being there for them and being persistent and making sure you're always there, educating yourself in that process too of what they're going through will probably help that, because then you can kind of look ahead and take that next step without getting a cue from that veteran, that person, and maybe being one step ahead by educating yourself on some of those subjects. That's
very true. Along with the resources, they can educate themselves to help them. And that's something that does happen a lot. A lot of spouses, and even when I say family members, I'm talking about like veterans and their parents.
Yeah.
They want those resources so they can know more about them for themselves and know what way can I help, especially if, some service members are resistant to receiving help. They can educate themselves so they have that knowledge for when that person is ready.
Yeah. And then how important is your own wellness as a veteran? Because I think when you're in the service, you're probably getting a lot of exercise, mentally, physically. As far as a veteran goes, how on a scale of 1 to 10, what would you say, health and wellness overall, how important is that for, someone struggling with PTSD or some trauma of some type, to get them back on track, or to at least keep them in a state of mind where they're open to treatment and open to, kind of blending into society?
I would say it's highly important. I had a conversation yesterday, and I had stated, if you don't live a healthy lifestyle and have a clear mind, what do you have? And
Right.
it all starts with wellness. Um, when I do, no matter what type of evaluation I do, I also put a recommendation in every time for fitness at least 3 times a week. I don't care what it is, running, walking, weightlifting, 3 times a week for 150 minutes. That's known to improve not only the mind, but to improve your health. A lot of people who are suffering, especially like with PTSD and depression, they don't realize how important it is to work out and exercise, how much that will improve their mindset if they do it.
Yeah.
Even eating, nutrition, a lot of people don't want to hear it, but
Yeah.
nutrition is key. Drinking lots of water is key. The number one thing that I suggest to everybody, you must get sufficient sleep. Your
Mhm.
body regenerates every night. And if you don't have sufficient sleep, how are you going to function the next day?
Right.
That just
Right.
worsens your mental health condition, because if you don't get the sleep, you're irritated, you're moody. And research shows that if you don't get, for adults, at least 7 to 8 hours of sleep, you are highly susceptible to having memory loss, attention problems, all those good things like cognitive functioning, things that you need to be able to do your daily activities. It declines the less sleep that you have. And not receiving sufficient sleep can lead to medical issues like heart disease.
Yeah.
So it's
Yeah.
highly important. Wellness, fitness, health is
Mhm.
highly important, no matter if you have a mental health condition or not.
Yeah. Well, it's interesting too. We've been in the supplement industry for a long time, and it's kind of turned into, it was dietary supplements, and then you would hear nutraceutical, and now like everyone's just saying wellness. So even if you're buying a dietary supplement, people like almost talk about it as a wellness product.
Mhm.
So I think you know using these products can also help in these situations where trying some of these new like nootropics and things that can help you focus. But I think specifically on the sleep category, because we do sleep, we do energy, we do focus, all these different types of categories, and sleep has now kind of transitioned, or I would say like backslash sleep recovery, and how important sleep is for recovery, whether you're, physical, working out, repairing muscle, or just your mental state. It's
Mhm.
such an important thing. We don't like talking about sleep on this show a lot because it's very frustrating for us. Um, because, everyone says, like you said a few times, get sleep. Well, some people can't sleep. And how do you get sleep? And we go through this all the time. And I read on, I scroll down LinkedIn, and there's these educated guys, PhDs on nutrition, like get enough sleep. I'm like, well, give us the secret. I can't sleep. How do you sleep? How many different products can you take? How many different pillows can you try out and things? If there are those nights where I sleep well, but I think
Mhm.
people struggle with that. I think if you ask people, do you want to sleep 9 or 10 hours? Everyone would be like, yeah, that's great. But it's difficult.
It is difficult. As one who has insomnia, it's difficult, but
Yeah.
I
So
make it work.
there you go. Well, you're gonna have to share the secret. Oh, we got another question.
Lindsay just says I don't sleep at all. Never been able to.
Okay. Well, you ain't getting any free product for that question. Lindsay. Nice try.
But I like that though.
Yeah, it's cute. What would you say? I wanted to ask you some of the treatments. What are some of the evidence-based treatments and therapies that have proven efficacy addressing some of these mental health conditions in veterans?
I would say the highly rated one is cognitive behavioral
Mhm.
therapy. And it's just because it's like the most empirically evidence-based form of therapy. And it treats a facet of issues: anxiety, depression, PTSD, memory, attention. The list goes on.
Mhm.
And when I used to do therapy back when I was doing clinical training in school, that was what I predominantly use. And I find it effective because, one, you're not in therapy for a long period of time. it's based on the person's need and the severity of the symptoms. So for example, it shouldn't be more than like maybe 20, 22 weeks. And it's very structured. You give them homework, and basically for them to improve and manage their symptoms, they have to do a lot of the work outside of therapy. So yeah, you might see me for an hour, but you have to do the work in order to change your mindset, view how you view yourself or struggle, because cognitive behavioral therapy is basically like retraining your brain on how you think, act, and behave. So you're going through a series of things on a weekly basis, and you're doing activities in therapy and outside of therapy. And it's been found to be really effective. However, it doesn't work for everybody, because there's some people who have like really, really severe symptoms, and sometimes like therapeutic modalities like CBT will not work. So they need something a little more, intense, like EDMR. And that's for people who have like treatment resistant depression, treatment resistant PTSD.
Mm-hmm.
And even though CBT is good for PTSD, there's trauma focused CBT therapy for those who really have highly severe symptoms just based on the traumatic experiences. So I would say those are some of the ones that have been known to work. However, CBT is like what we call the gold standard. And the more, invasive ones are like a last resort, especially if medication doesn't help and those symptoms are still like treatment resistant.
Yes. I see another question. Okay, Lindsay.
Now she has a real question.
Now she wants to for your product. Okay.
She says, what do you think about cannabis and PTSD? I've read a lot of research about affecting the hippocampus.
I will say I don't have much background in that area, but I have worked with some service members who were actually provided like a marijuana license, a medical license to be able to do it. And I know some of them said it had worked in terms of mood symptoms, like really calming them down. Those that had like anxious symptoms or very irritable, it worked in those facets, but I don't know like for a long time or a long-term therapy, if that would be something that would be conducive to managing symptoms in the long term.
Yeah, I guess I would think it's all how you use it, right? And then
all how you use it and if you abuse it, because I know some of them abuse it.
Correct, yeah.
Yeah.
But one thing I do know with, because I had a family member who had cancer and used medical cannabis, and people think like it's supposed to replace chemo, which it's not. What it does is it helps people sleep. So we've talked about sleep, and we know that if you're using it and you're sleeping better, well, you just, did something wonderful. You're getting sleep, you're getting recovery, and you're doing exactly what, you talked about earlier about how important sleep is. So, we have done some research with cannabinoids, and we've done some research with psychedelics, which we talked about earlier before the show, which I think would be an interesting show coming up, to especially for the military, because I know they're making some progress there for treatment. But overall, this has been a wonderful experience for me, because I feel like I'm more educated. It's just a topic that, I don't know much about. And then when we met you, Monique, I was reading your credentials, and I'm like, oh, this is going to be such and you thought of the idea of the show topic, which I thought was great, because it really struck a chord with a lot of us here. I know Keith and Rob, my partner, who's not here tonight, but we really enjoyed the conversation, the topic. We'd love to have you back on. Before we sign off, how can people get in touch with you and get your services?
So I do have a professional website. It's www.Chouraeshkenazigroup.com, and guess we can spell that later.
Yeah.
But I do have LinkedIn, Facebook, Instagram, and X, and it's all like my handle is my last name. So you can find me there. If you have any questions, want to reach out, or if you want any services like consulting or evaluation, you can find me.
That's awesome. And guys, we do have the links in the subject. Once we post the video after tonight live show, you'll be able to get Dr. Monique's links to find her. Once again, Doctor, thank you so much for being on. It was a pleasure. Well, so much education. I've got like 6 questions here that I want to ask you on the military, the job situation,
Uh-huh.
even maybe we get into psychedelics. So I hope you come back. It was a pleasure having you.
Yes.
And as we sign off, guys, if you or someone you know is a veteran struggling with their mental health, please reach out for support. We have included an extensive list of resources, support organizations in the show notes, including the Veterans Crisis Line, Wounded Warrior Project, and the National Alliance on Mental Illness, which is NAMI. Veterans Resource Center, you're not alone. Help is available, and here at Project Y remain committed to fostering a culture of understanding, empathy, and support for all men, especially those who have made the selfless sacrifice of serving our nations. Let's continue to break down the stigma that we talked about earlier surrounding mental health and your wellness. That's what Project Y is about. And work together to ensure that all veterans receive the comprehensive care and support that they deserve to lead a healthy and fulfilling life. And if you enjoyed this episode, hit the like button, subscribe, and share it with a friend. And don't forget to drop your questions or relationship experience in the comments below. Any other questions you have about tonight's show, you can email me at tony@projectynow.com or just message Dr. Monique and get some of her services. She's very experienced and we loved having her. Special thanks to RCJ Productions, Keith and Lindsay. Thanks again. Another great show, guys. Appreciate all your help and support. If it wasn't for you guys, we would not be here. Check us out on our socials, YouTube channel at the Ycast, Facebook Project Y, Instagram, LinkedIn, and TikTok Project Y Now. And we'll see you guys on June 4th. Thanks again, guys.
Thanks.
See you next time.
Thank you so much for having me. I really appreciate it. Thank you.
Our pleasure.
Thanks, Mike. Thank you very much.
Yeah.